Tube insertion. During tube insertion, the tube sometimes slips into the larynx or coils in the throat, which can result in coughing and gagging. The nurse should withdraw the tube slightly and then stop or pause while the client takes a few breaths. After the client stops coughing, the nurse can proceed with advancement, asking the client to take small sips of water to facilitate advancement to the stomach. The client should not be asked to swallow during coughing or aspiration may occur. If resistance or obstruction occurs during tube advancement, the nurse should rotate the tube while trying to advance it. If resistance continues, the tube should be withdrawn and inserted into the other nares if possible. Foley catheter. In the male client, it is recommended that the catheter be inserted 7 to 9 in, 17 to 22.5 centimeters, or until urine flows out, due to the longer urethra. The catheter should then be inserted at least an additional 1 in, 2.5 centimeters, or to catheter bifurcation. Insert the Foley urinary catheter further if drops appear in the tubing to ensure that the tip with the balloon is in the bladder. Inflating the balloon before advancing the catheter could result in urethral trauma. Shingles. Herpes zoster is a reactivation of the varicella zoster, chickenpox virus. It is more likely to occur when a client's immune system is compromised by disease, e.g., HIV infection, or treatments, e.g., chemotherapy. Shingles lesions that are open may transmit the infection by both air and contact. The client with disseminated shingles that are not crusted over will require contact precautions, airborne precautions, and a negative airflow room to prevent transmission of the infection to others in the hospital. Negative airflow pulls air from the hospital environment into the room, and the air from the hospital room then goes directly to the outside rather recirculating to the rest of the hospital. Localized shingles require only standard precautions for clients with intact immune systems and contained, covered lesions. Heimlich maneuver. Primary rescue intervention for children over age 1 with a foreign body airway obstruction causing respiratory distress. Back blows and chest thrusts are appropriate interventions for a choking infant under age 1. Blind sweeping of a child's mouth should not be attempted. Contact precautions. Clients with multidrug-resistant organisms, MRSA, VRE, C. difficile diarrhea, and scabies require nursing staff to implement contact precautions. Mastectomy. Immediately after mastectomy surgery, the client is placed in a semi-Fowler's position with the affected side's arm and hand elevated on several pillows to promote drainage and prevent venous and lymphatic pooling. Flexing and bending of the affected side's fingers is begun immediately with gradual increase in arm movement over the next few postoperative days. Postoperative arm and shoulder exercises are initiated slowly with the goal of full range of motion of the affected side within 4 to 6 weeks of the mastectomy. Management for lymphedema includes decongestive massage therapy, compression bandages or sleeves, elevation of the arm above heart level, isometric exercises, and avoidance of venipuncture or blood pressure measurements on the affected limb. Postmenopausal. A postmenopausal woman, usually after age 51, is at risk for osteoporosis and heart disease. Clients should take med with full glass of water and remain upright for 30 minutes after taking a bisphosphonate and consume calcium and vitamin D for bone health. Clotting disorder is a risk with HRT, hormone replacement therapy. Intermittent vaginal spotting after menopause can be a sign of endometrial cancer. Weight loss. Create my plate method for meal planning. 1. Monitor carbohydrate intake. 2. Manage caloric intake if weight loss is desired. Downloaded by DNA Mads, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. 3. High fiber foods, 30-35 grams of fiber per day, including whole grains, legumes, fruits, vegetables, and low-fat dairy products. 4. Use monounsaturated fats, limit use of saturated fat, and eliminate trans fatty acids. 5. Choose foods with a low glycemic index. 6. Consume total cholesterol of less than 300 mg per day. 7. Reduce sodium intake. 8. Limit intake of foods containing sucrose. 9. Limit intake of alcoholic beverages. Laparoscopic cholecystectomy. The highest postoperative priority after a laparoscopic cholecystectomy is prevention of any respiratory complications potentiated by carbon dioxide administration during surgery. Place patient in SIM position. VFib. VF is a lethal dysrhythmia. The client will not recover without immediate treatment. Interventions consist of activation of the emergency response system, CPR, defibrillation, and drug therapy, epinephrine and then amiodarone. Mechanically, there is no effective contraction, cardiac output, or pulse. COPD. Clients with COPD need to report any signs of infection, including change in their normal sputum, as infection is a primary cause of exacerbation. Any client with COPD should have a pneumococcal vaccine and an annual influenza virus vaccine. RA. Clients with RA are taught symptom management techniques and lifestyle modifications to protect joints by preventing contracture with range of motion exercises, allowing for periods of rest, and using moist heat for stiffness and cold packs for joint pain. Morning stiffness rhabdomyolysis, medical emergency caused by muscle injury that releases myoglobin into the bloodstream. The nurse's priority when treating the client is to preserve kidney function by administering large volumes of IV fluid. Balance and coordination. The cerebellum is involved in coordination of voluntary movements and maintenance of balance and posture. Balance is assessed with heel-to-toe gait testing. Coordination is assessed with finger tapping, rapid alternating movements, finger-to-nose testing, and heel-to-shin testing. Liver failure labs. Low serum albumin causes ascites, elevated INR increases risk for bruising and bleeding, elevated serum ammonia causes lethargy and confusion, and increased bilirubin causes jaundice and itching. The chronic, progressive destruction characteristic of cirrhosis causes bilirubin, ammonia, and coagulation studies, PT, INR and APTT, to become elevated. Hyponatremia and hypoalbuminemia are to be expected. Essential nursing actions related to a needle liver biopsy include checking coagulation, blood type, and cross-match beforehand, positioning the client on the right side for hours afterward, and monitoring vital signs and for potential signs of shock. AFib. A T is indicated prior to cardioversion for a client who has been in AF for more than 48 hours, as cardioversion is contraindicated in the presence of an atrial thrombus. Bowel obstruction. When a small bowel obstruction develops, fluid and gas collect proximal to the obstruction, producing rapid onset of nausea and vomiting, colicky intermittent abdominal pain, and abdominal distension. Absolute constipation and lack of flatus are usually seen with large bowel obstruction. Delay in small bowel obstruction assessment could lead to vascular compromise, bowel ischemia, or perforation. Nursing management. Placing the client on NPO status, inserting a nasogastric tube, administering prescribed IV fluids, and instituting pain control measures. Downloaded by DNA Mads, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. Heart failure. The nurse should assess the BNP level in clients admitted with heart failure exacerbations. Elevated BNP levels indicate increased ventricular stretch and correlate with severity of heart failure and fluid volume overload. Heart failure clients may also present with jugular venous distension, low serum sodium, and decreased urine output. Orthodox Jewish. Clients of the Orthodox Jewish faith follow kosher rules. These include no pork, shellfish, or fish without scales. When meat or poultry is consumed, at least 3 to 6 hours must pass before a dairy product can be consumed. Pap screening. Women aged 21 to 65 are screened every 3 years. Women age greater than 65 with previous normal results do not need testing. Women who have had a hysterectomy with cervical removal do not require Pap testing. COD. COD can occur due to lung cancer and is characterized by water retention, increased total body water, and dilutional hyponatremia. Hyponatremia may cause neurologic complications, e.g., confusion, seizures. COD treatment includes fluid restriction, oral salt tablets, and administration of 3% saline IV, hypertonic, and/or vasopressin receptor antagonists. Shock syndrome. Adequacy of tissue perfusion in a client with shock syndrome and possible organ dysfunction is assessed by the level of consciousness, urine output, capillary refill, peripheral sensation, skin color, extremity temperature, and peripheral pulses. Lower extremity DVT. Clinical manifestations characteristic include unilateral edema, calf pain or tenderness to touch, warmth and erythema, and low-grade temperature. Pericardial effusion. Clients with pericardial effusion should be monitored and assessed closely for the development of cardiac tamponade. Signs and symptoms of tamponade include muffled or distant heart tones, hypotension, narrowed pulse pressure, jugular venous distension, and pulsus paradoxus. SVT. Supraventricular tachycardia is irregular, narrow QRS complex tachycardia with a rate of around 150 to 220 per minute. The best treatment is vagal maneuvers and adenosine IV push. Treatment of hyperkalemia. The priority in treatment of hyperkalemia with ECG changes, e.g., peak T waves, is administration of intravenous calcium gluconate to prevent life-threatening dysrhythmias. Once calcium gluconate is administered, prescriptions to correct serum potassium, e.g., intravenous regular insulin with dextrose, sodium polystyrene sulfonate, hemodialysis, may be implemented. Management of anaphylactic shock. 1. Stop the infusion that is causing the reaction and call for help, e.g., rapid response team. 2. Ensure patent airway, then administer oxygen via a high-flow non-rebreather mask and prepare for intubation if needed. 3. Give epinephrine intramuscularly. Epinephrine counteracts the effect of the histamines released, dilating bronchial smooth muscles and providing vasoconstriction. Most deaths from anaphylaxis are due to delaying epinephrine. Maintain blood pressure with normal saline IV fluid. 4. Administer adjunctive therapies, bronchodilators, e.g., albuterol, to dilate the small airways and reverse bronchoconstriction, antihistamines, e.g., diphenhydramine, to modify the hypersensitivity reaction, and corticosteroids, e.g., methylprednisolone, to decrease airway inflammation and swelling associated with the allergic reaction. 5. Continue to reassess vital signs for any changes downloaded by DNA MADS, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. Fat embolus syndrome. There are no specific diagnostic tests to identify fat embolus syndrome, FES. However, the initial characteristic signs and symptoms include respiratory problems, e.g., dyspnea, tachypnea, hypoxemia, after a fat embolus travels through the pulmonary circulation and lodges in a pulmonary capillary, leading to impaired gas exchange and acute respiratory failure. This pathophysiology is similar to that of a pulmonary embolus. Neurologic changes, e.g., altered mental status, confusion, restlessness, which occur due to cerebral embolism and hypoxia. Petechial rash, e.g., pin-sized purplish spots that do not blanch with pressure, which appears on the neck, chest, and axilla due to microvascular occlusion. This defining characteristic differentiates a fat embolus from a pay fever, greater than 101.4 F, which is due to a cerebral embolism leading to hypothalamus dysfunction. Parkland-Burn equation. The Parkland formula calculates IV fluid resuscitation therapy necessary for the first 24 hours to stabilize a burn victim as normal fluid regulation is lost in burned tissue. The key to answering this question is knowing that half of the calculated fluid must be administered in the first 8 hours. The initial answer will be divided by 2. The other half of the fluid is administered over the next 16 hours. Crystalloid solutions, e.g., Ringer's lactate, are commonly used. First 24 hours of fluid equals 4 ml*, weight in kilogram, percentage of body surface area burned, chronic bronchitis. Interventions to help reduce viscosity of mucus, facilitate secretion removal, and promote comfort in clients with chronic bronchitis include the following: increasing oral fluids to 2 to 3 L per day if not contraindicated, cool mist humidifier to increase room humidity, guaifenesin, Robitussin, an expectorant, to reduce viscosity of secretions, huff, coughing. The warning signs of cancer can be remembered with the acronym CAUTION. Change in bowel or bladder habits, a sore that does not heal, unusual bleeding or discharge from a body orifice, thickening or a lump in the breast or elsewhere, indigestion or difficulty in swallowing, obvious change in a wart or mole, nagging cough or hoarseness. Seizure manifestations generally are classified into 4 phases. 1. The prodromal phase is the period with warning signs that precede the seizure, before the oral phase. 2. The oral phase is the period before the seizure when the client may experience visual or other sensory changes. Not all clients experience or can recognize a prodromal or oral phase before the seizure. 3. The ictal phase is the period of active seizure activity. 4. During the postictal phase, the client may experience confusion while recovering from the seizure. The client may also experience a headache. Postictal confusion can help identify clients by differentiating seizures from syncope. In syncope, there will be only a brief loss of consciousness without prolonged post-event confusion. PTT. Clients who are receiving heparin infusion for pulmonary embolism or deep venous thrombosis should be maintained with a partial thromboplastin time of 1.5 to 2 times the reference range used by the laboratory measuring the level. The normal reference range is typically 25 to 35 seconds. Crackles. Fine crackles in the lungs usually indicate atelectasis. The presence of coarse crackles, elevated jugular venous distension, and peripheral edema usually indicates volume overload, fluid in the alveoli. In addition, clients with fluid overload breathe at a rapid rate, tachypnea, rather than take slow, shallow breaths. CO2 poisoning. Clients with carbon monoxide, CO, poisoning have elevated serum carboxyhemoglobin levels, normal less than 5% in downloaded by DNA MADS, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. Non-smokers, and false normal pulse oximeter readings. They require immediate administration of 100% oxygen to correct hypoxemia and eliminate toxic CO from the blood. The assessment data most characteristic of PAE include dyspnea, 85%, pleuritic chest pain, 60%, tachycardia, tachypnea, hypoxemia, impaired gas exchange, decreased perfusion with normal alveolar ventilation, shunting, apprehension and anxiety. Clinical manifestations of hypovolemic shock are associated with inadequate tissue perfusion and include change in mental status, tachycardia with thready pulse, cool, clammy skin, oliguria, tachypnea, ICP. Notify the HCP of signs, symptoms of increased ICP, including unexpected vomiting. The vomiting is often projectile, associated with headache, and gets worse with lowering the head position. Cirrhosis. A client diagnosed with cirrhosis may experience pruritus, itching, due to buildup of bile salts beneath the skin. The nurse encourages the client to cut the nails short, wear cotton gloves, and wear long-sleeved shirts to avoid injury to the skin from scratching. Other comfort measures include baking soda baths, calamine lotion, and cool, wet cloths, which cool and soothe irritated skin. OA, also known as degenerative joint disease, is a disorder of the synovial joints, e.g., knee, hip, fingers. OA causes progressive erosion of the articular, joint, cartilage and bone beneath the cartilage. As the degenerative process continues, bone spurs, osteocytes, calcifications, and ulcerations develop within the joint space, and the cushioning between the ends of the bones breaks down. Although not a normal consequence of aging, it is the most common form of arthritis in clients greater than 55 years of age. Characteristic manifestations of OA of the knee joint include pain, often described as aching, exacerbated by weight-bearing activities, results from synovial inflammation, muscle spasm, and nerve irritation. Crepitus, a grating noise or sensation with movement that can be heard or palpated, results from the presence of bone and cartilage fragments that float in the joint space. Morning stiffness that subsides within about 30 minutes of arising. Decreased joint mobility and range of motion. Atrophy of the muscles that support the joint, e.g., quadriceps, hamstring, due to disuse. Chemo. Bone marrow suppression from chemotherapy can cause decreased red blood cells, white blood cells, and platelets. Erythropoietin is used to increase red blood cell production, and filgrastim is administered to stimulate neutrophil production. Filgrastim, Neupogen, and pegfilgrastim, Neulasta, stimulate neutrophil production and are given prophylactically or if the client has an infection and more neutrophils are needed to fight it. Cancer chemotherapy causes cell lysis, which results in tumor lysis syndrome due to massive release of nucleic acid and its metabolic product, uric acid. Uric acid deposition leads to acute kidney injury. Medications such as allopurinol or rasburicase and aggressive IV hydration are used to prevent this complication. Clinical manifestations that indicate impending respiratory failure in asthma clients include PaCO2 greater than 50 mm Hg, respiratory acidosis, PaO2 less than 60 mm Hg change in mentation, e.g., restlessness, confusion, lethargy, drowsiness, downloaded by DNA Mads, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. Paradoxical breathing, silent chest and absence of wheezing, single-word dyspnea, chest tube. The nurse should immediately report chest tube drainage greater than 3 ml per kilogram per hour over 3 consecutive hours or 5 to 10 ml per kilogram over 1 hour. This could indicate postoperative hemorrhage. Cardiac tamponade can occur rapidly in children and can be life-threatening. Hypocalcemia. Acute hypocalcemia can be life-threatening due to seizures, tetany, laryngeal stridor, and cardiac arrhythmias. Inadvertent removal of the parathyroid gland can result in rapid development of severe hypocalcemia. Fifth disease. Children with fifth disease are communicable only prior to onset of symptoms, e.g., rash, joint pains. The causative agent, human parvovirus, spreads via respiratory secretions. Fifth disease is self-limiting and short-lived. Treatment is given to alleviate symptoms. Isolation is not usually required for a non-hospitalized child. Above-the-knee amputation. Care of the client with above-the-knee amputation includes placement in prone position for 30 minutes 3 or 4 times a day and using a figure-8 compression bandage to decrease edema. The client's residual limb should not be elevated as this will promote flexion contractures. Pericarditis. Characterized by typical pleuritic chest pain that is sharp. It is aggravated during inspiration and coughing. Pain is typically relieved by sitting up and leaning forward. Treatment includes a combination of NSAIDs or aspirin plus colchicine. Bacterial meningitis. Key characteristics of bacterial meningitis in infants under age 2 include frequent seizures, a high-pitched cry, poor feeding, nuchal rigidity, and possible bulging fontanelles. MAP should be maintained at greater than 65 mm Hg in septic or anaphylactic shock. Normal POP is 6 to 12 mm Hg. Left to right cardiac shunts. All left to right cardiac shunts, e.g., ventricular septal defect, atrial septal defect, will cause an increase in pulmonary blood flow. Shunt reversal can eventually result in heart failure. Children should be kept in an upright position and offered small, frequent feedings to decrease workload of the heart and lungs. Celiac disease. A child with celiac disease cannot eat barley, rye, oats, or wheat. Mnemonic, brow. Cane. The nurse may use the mnemonic, up with the good and down with the bad. Cane always moves before the weaker leg. Licorice. The nurse should discourage the client from using the herbal remedy licorice root when taking thiazide diuretics. Licorice root can potentiate potassium loss and increase the client's risk for hypokalemia. Use of licorice root should be reported to the PCHP. Infant. Infants grow rapidly and by age 12 months, the head and chest circumference are equal, triple the birth weight. The infant should also be able to sit down from a standing position without assistance. Infants should double in birth weight by age 6 months and triple in birth weight by age 12 months. At birth, head circumference is slightly more than chest circumference, but these equalize by age 12 months. The posterior fontanelle fuses by age 2 months, and the anterior fontanelle fuses by age 18 months. Downloaded by DNA Mads, alt.001900@gmail.com, Lomoarch CPSD, 19,001,587. Hemolytic uremic syndrome. Hemolytic uremic syndrome is a life-threatening complication of Escherichia coli diarrhea. Clinical features include anemia, pallor, low platelets, petechia and purpura, and acute kidney injury, low urine output. Allergy skin testing. To ensure an accurate result, the client should avoid taking any antihistamines such as diphenhydramine and loratadine for a week or more prior to the test. Antihistamines block mast cell release of histamines that are responsible for allergic symptoms. Systemic corticosteroids, which are used to treat the inflammatory component of asthma, can interfere with the accuracy of allergy skin testing as well. Therefore, the use of these medications should be assessed. Acetaminophen will not interfere with allergy skin testing, but nonsteroidal anti-inflammatory drugs and aspirin may be included in the list of medications to avoid. Albuterol, a short-acting beta-adrenergic agonist that is the client's asthma rescue medication, should not be discontinued as it is necessary to ensure safety during an asthma attack. It will not interfere with allergy skin testing results. Permissive hypertension is allowed within the first 24 to 48 hours of an acute ischemic stroke provided that the blood pressure is less than 220/120ths of a millimeter Hg. The blood-brain barrier is not intact above this level. This allows perfusion of the penumbra to keep the stroke from extending. Oxygen delivery. Low-flow oxygen delivery devices, e.g., nasal cannula, simple face mask, deliver oxygen concentrations that vary with breathing patterns. They are appropriate for clients who can tolerate varying concentrations, e.g., stable COPD, type I respiratory failure. High-flow oxygen delivery devices, e.g., Venturi mask, mechanical ventilator, deliver oxygen concentrations that do not vary with breathing patterns. They are appropriate for clients who cannot tolerate varying concentrations, e.g., exacerbation COPD, type E respiratory failure. Pheochromocytoma is a condition caused by a tumor in the adrenal medulla that causes release of catecholamines such as epinephrine and norepinephrine, resulting in paroxysmal hypertensive crisis. Hypertensive crisis puts the client at risk for stroke and should be treated promptly with intravenous nitroprusside or another vasodilator, e.g., phentolamine, nicardipine. Abdominal palpation should be avoided in these clients. Malignant hyperthermia, MH, is a rare, life-threatening inherited muscle abnormality that is triggered by certain drugs used to induce general anesthesia. The most specific characteristic signs and symptoms of MH include hypercapnia, muscle rigidity, and hyperthermia. The nurse would notify the healthcare provider, indicating the need for immediate treatment, e.g., dantrolene, cooling blanket, fluid resuscitation, and SBFT. Uses sequential X-ray images to visualize the structure and function of the small intestine. The client should fast for 8 hours prior to the examination. Stools may be chalky for up to 72 hours. Black, tarry stools indicate a potential gastrointestinal bleed and should be reported immediately. Breast engorgement is often painful, and the following treatments are recommended to relieve discomfort. Apply ice packs to both breasts for 15 to 20 minutes every 3 to 4 hours. Ice causes vasoconstriction and reduces blood flow and swelling. Apply chilled, fresh cabbage leaves to both breasts, replacing them with fresh leaves after they wilt. The mechanism of action is unclear but may be related to the cool temperature or to the phytoestrogens from the leaves themselves. Take an anti-inflammatory analgesic, such as ibuprofen, which is recommended for the pain associated with breast engorgement. Downloaded by DNA Mads, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. Scabies is spread easily via direct skin-to-skin contact. Due to the lengthy incubation period of scabies, all who have been in contact with the infested child must be treated. This involves a one-time application of a scabicide, typically 1% topical permethrin. The child's bedding and clothing should be placed in plastic bags, for a minimum of 3 days, or washed in hot water and dried on the hottest dryer cycle. Common causes of metabolic acidosis include GI bicarbonate losses, e.g., diarrhea, ketoacidosis, e.g., diabetes, alcoholism, starvation, lactic acidosis, e.g., sepsis, hypoperfusion, renal failure, e.g., hemodialysis with inaccessible arteriovenous shunt, salicylate toxicity. Appropriate treatment for suspected hypoglycemia is 15-20 grams of quick-acting carbohydrate. Appropriate food choices would include 4 to 6 ounces of regular soda, 8 to 10 Lifesavers candies, 1 tablespoon honey or syrup, 4 teaspoons jelly, 4 to 6 ounces orange juice, 8 ounces low-fat milk, are commercial dextrose products. The treatment is repeated in 15 minutes if there is no improvement. CVP and POP. The client's central venous pressure, CVP, is elevated, normal value 2 to 8 mm Hg, indicating increased systemic circulation volume and increased right ventricular preload. Pulmonary artery wedge pressure, POP, is also elevated, normal value 6 to 12 mm Hg, indicating increased left ventricular preload. In the presence of increased CVP and POP, coarse crackles indicate left-sided failure. The treatment goal is to decrease fluid volume and preload. Furosemide is a loop diuretic that will decrease both left and right-sided preload. MAP, 70-105 mm Hg, veal chop. An acceleration of the fetal heart rate of at least 15 per minute above the baseline lasting for at least 15 seconds is a reassuring finding, most often indicating fetal movement. Moderate variability refers to fluctuations in the baseline heart rate between 6 to 25 per minute. It is considered normal and indicates that the fetus is healthy and has adequate oxygenation and normal function of the autonomic nervous system. No immediate intervention is needed. A non-reassuring heart rate pattern such as late or variable decelerations would require the need to stop oxytocin, apply oxygen, and notify the HCP. Retinoblastoma is a malignancy of the eye typically diagnosed in children under age 2. The pupil will reflect a white color, and the child will not have the normal red-eye reflex. Treatment may include radiation therapy or enucleation, removal of the eye.
There are 3 categories of PTSD symptoms. 1. Re-experiencing the traumatic event. Examples include intrusive memories, flashbacks, recurring nightmares, and feelings of intense distress, loss of control, or strong physical reactions to event reminders, e.g., rapid, pounding heart, gastrointestinal distress, diaphoresis. 2. Avoiding reminders of the trauma. Examples include avoidance of activities, places, thoughts, or other triggers that could serve as reminders, feeling detached and emotionally numb, loss of interest in life, inability to set goals, and amnesia about important details of the event. 3. Increased anxiety and emotional arousal. Examples include insomnia, irritability, outbursts of rage, persistent anger and/or fear, difficulty concentrating, hypervigilance, and exaggerated startle response. Clinical manifestations of cold stress include neurological, altered mental status, irritability or lethargy, cardiovascular, bradycardia, respiratory, tachypnea early, followed by apnea and hypoxia, gastrointestinal, high gastric residuals, emesis, hypoglycemia, musculoskeletal, hypotonia, weak suck and cry. Downloaded by DNA Mads alt.001900@gmail.com, Lomo RCPSD, 19,001,587.
Hemophilia A. A client with hemophilia in a head injury is at risk for intracranial bleeding, which sometimes occurs spontaneously. When intracranial or another form of bleeding is suspected, administration of factor V is a priority as the client's body cannot form a clot without it. Sjogren's syndrome is an autoimmune condition. It causes inflammation of the exocrine glands, e.g., lacrimal, salivary, resulting in decreased production of tears and saliva and leading to dry eyes, xerophthalmia, and dry mouth, xerostomia. Paracentesis is a procedure that involves removal of excess fluid from the peritoneal cavity, ascites, and is performed to relieve dyspnea and discomfort related to increased intra-abdominal pressure and fluid volume. Hypovolemia is an associated complication related to intravascular fluid shifts that occur during and post-procedure and also to high-volume peritoneal fluid removal, greater than 5 L. The nurse should first validate the presence of lightheadedness and unsteady gait, monitor vital signs, and assess for manifestations of hypovolemia, e.g., orthostatic hypotension, tachycardia, reduced pulse volume, decreased urine output, as decreased circulating volume can lead to hemodynamic instability. Placental abruption is a possible complication of preeclampsia that can be life-threatening to mother and baby. It occurs when the placenta tears away from the wall of the uterus due to stress, causing significant bleeding to the mother and depriving the baby of oxygen. Bleeding can be concealed inside the uterus. This may require immediate delivery of the baby. HELP. Elevated liver enzymes can indicate the start of a more serious condition called HELP, hemolysis, elevated liver enzymes, low platelets, another complication of preeclampsia. This client will need additional laboratory work. If HELP is diagnosed, the only treatment is delivery. Preeclampsia. In pregnancy manifests with high blood pressure and protein in the urine. Edema is expected, although it is not part of the criteria. Complications of preeclampsia include eclampsia, placental abruption, and HELP, hemolysis, elevated liver enzymes, low platelets, syndrome.
Initial interventions in emergency management of chest pain are as follows. Assess airway, breathing, and circulation ABCS, position client upright unless contraindicated, apply oxygen. If the client is hypoxic, obtain baseline vital signs, including oxygen saturation, auscultate heart and lung sounds, obtain a 12-lead electrocardiogram, ECG, insert 2 to 3 large bore intravenous catheters, assess pain using the PQRST method, medicate for pain as prescribed, e.g., nitroglycerin, initiate continuous electrocardiogram, ECG, monitoring, cardiac monitor, obtain baseline blood work, e.g., cardiac markers, serum electrolytes, obtain portable chest X-ray, assess for contraindications to antiplatelet and anticoagulant therapy, administer aspirin unless contraindicated. Hyperemesis gravidarum is a disorder that causes pregnant clients to have severe nausea and vomiting.
This leads to fluid and electrolyte imbalances, nutritional deficiencies, ketonuria, and weight loss. On assessment, the nurse should expect signs and symptoms of dehydration, which include dry mucous membranes, poor skin turgor, decreased urine output, tachycardia, and low blood pressure. Ketonuria indicates that the body is breaking down fat to use for energy due to the client's starvation state. Downloaded by DNA Mads, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. Sickle cell. Laboratory results that support a vaso-occlusive crisis, pain crisis, in a client with sickle cell disease include elevated reticulocytes, elevated bilirubin, and anemia. Addison's disease. Corticosteroid therapy is the primary classification of drugs used to treat Addison's disease and adrenocortical insufficiency. Signs and symptoms of infection should be reported to the PHCP immediately. Use of corticosteroids can cause immunosuppression. Infection can develop quickly and spread rapidly. Its anti-inflammatory effects may also mask signs of infection such as inflammation, redness, tenderness, heat, fever, and edema. In addition, physiological stress such as infection can trigger Addisonian crisis. A life-threatening complication of Addison's disease. Addison disease include the following: slow, progressive onset of weakness and fatigue, anorexia and weight loss, orthostatic hypotension, hyponatremia and hyperkalemia, salt cravings, nausea and vomiting, depression and irritability. Acute glomerulonephritis is most often caused by recent streptococcal infection. Nursing care is focused on monitoring vital signs, particularly blood pressure, assessing fluid status, avoiding salt in the diet, and conserving energy. Prostatitis. Care of the client with prostatitis includes anti-infective and anti-inflammatory medications, stool softeners, sitz baths, and decreasing retained prostatic fluid via ejaculation. Hydration and avoidance of caffeine should also be promoted. Types of impaired thought processes seen in individuals with schizophrenia include the following: neologisms, made-up words or phrases usually of a bizarre nature. The words have meaning to the client only. Example: I would like to have a PHJ inox. Concrete thinking, literal interpretation of an idea. The client has difficulty with abstract thinking. Example: the phrase, "the grass is always greener on the other side," would be interpreted to mean that the grass somewhere else is literally greener. Loose associations, rapid shifting from one idea to another, with little or no connection to logic or rationality. Echolalia, repetition of words, usually uttered by someone else. Tangentiality, going from one topic to the next without getting to the point of the original idea or topic. Word salad, a mix of words and or phrases having no meaning except to the client. Example: here what comes: table, sky, apple. Clang associations, rhyming words in a meaningless, illogical manner. Example: the pike likes to hike and Mike fed the bike near the tike. Perseveration, repeating the same words or phrases in response to different questions. Systemic inflammatory response syndrome, SIRS, occurs when the body undergoes a major insult, e.g., trauma, infection, burns, hemorrhage, multiple transfusions. Stimulation of the immune response leads to activation of white blood cells, WBCS, release of inflammatory mediators, increased capillary permeability, and inflammation of organs. Diagnostic criteria for SIRS include 2 or more of the following manifestations: hyperthermia, temperature greater than 100.4 F, or hypothermia, temperature less than 96.8 F, heart rate greater than 90 per minute, respiratory rate greater than 20 per minute, or alkalosis, PaCO2 less than 32 mm Hg, leukocytosis, WBC count greater than 12,000 per cubic millimeter or 10% immature neutrophils, polycythemia vera, are at risk of developing thrombosis and should be taught preventive measures, e.g., elevating the legs when sitting, and symptoms to report. They should take measures to prevent dehydration, and avoid iron-rich foods and hot showers, baths. Polycythemia vera, PV, is a chronic myeloproliferative disorder in which the bone marrow produces an abnormally high downloaded by DNA MADS, alt.001900@gmail.com, Lomoark PSD, 19,001,587. Number of red blood cells, RBCS. Although PV is an abnormality of the bone marrow, secondary polycythemia can occur in an individual with chronic hypoxemia, such as chronic obstructive pulmonary disease or chronic lung disease. The danger of PV is seen when the client develops blood clots, due to the increased viscosity of the blood, which makes the circulation sluggish, and decreasing tissue perfusion. Treatment of PV usually includes periodic phlebotomy, the removal of 300 to 500 milliliters of blood through venipuncture, to reduce the RBC count and achieve a hematocrit of less than 45%. Initially, clients may require phlebotomy every other day until the goal hematocrit is reached. Hematocrit is then monitored monthly, and additional blood draws performed as necessary. Hypoglycemia-associated symptoms, including increased heart rate, shakiness, sweating, hunger, anxiety, and pallor. Fetus. Fetal heart tones can be detected by 7 weeks gestation. Fetal sex may be determined on ultrasound as early as the end of 12 weeks gestation. Fetal movements are typically felt at around 16 to 20 weeks gestation. Cleft palate. CP is at risk for aspiration and inadequate nutrition due to eating and feeding difficulties. This is due to the infant's inability to create suction and pull milk or formula from the nipple. Until CP can be repaired, the following feeding strategies increase oral intake and decrease aspiration risk. Hold the infant in an upright position, which promotes passage of formula into the stomach and decreases the risk of aspiration. Tilt the bottle so that the nipple is always filled with formula. Point down and away from the cleft. Use special bottles in nipples, including cross-cut and preemie nipples in assisted delivery bottles. These devices allow formula to flow more freely, decreasing the need for the infant to create suction. Using a squeezable bottle allows the caregiver to apply pressure in rhythm with the infant's own sucking and swallowing. These infants swallow large amounts of air during feeding and so need to be burped more often to avoid stomach distension and regurgitation. Feeding slowly over 20 to 30 minutes reduces the risk of aspiration and promotes adequate intake of formula. Feeding every 3 to 4 hours. More frequent feedings may be tiring for the infant and the mother. Some infants may need to be fed more frequently if they are not consuming adequate amounts of formula. The priority needs: 1. ABCS plus V, airway, breathing, circulation, and vital signs. 2. Mental status changes, acute pain, unresolved medical issues, acute elimination problems, abnormal laboratory values, and risk. 3. Longer-term issues such as health education, rest, and coping. Hypomagnesemia. A low blood magnesium level, normal 1.5 to 2.5 mEq/L, is associated with alcohol abuse due to poor absorption, inadequate nutritional intake, and increased losses via the gastrointestinal and renal systems. It is associated with 2 major issues. 1. Ventricular arrhythmias, torsades de pointes. This is the most serious concern, priority. 2. Neuromuscular excitability. Manifestations of low magnesium, similar to those found in hypocalcemia and demonstrated by neuromuscular excitability, include tremors, hyperactive reflexes, positive Trousseau and Vostok signs, and seizures. Epiglottitis, supraglottitis. It is an inflammation by bacteria of the tissue surrounding the epiglottis, a long, narrow structure that closes off the glottis during swallowing. Edema can develop rapidly, as quickly as a few minutes, and obstruct the airway by occluding the trachea. There has been a 10-fold decrease in its incidence due to the widespread use of the HIB. The classic symptoms include a high-grade fever with toxic appearance, severe sore throat, and the 4 deciseconds, dysphonia, muffled voice, dysphagia, difficulty swallowing, drooling, and distressed respiratory effort. The tripod position opens the airway and helps airflow. The child should be allowed to assume a position of comfort, usually sitting rather than lying down. The priority nursing response is to protect the airway. Downloaded by DNA Mads, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. Third-degree avenue block. Results in dissociation of atrial and ventricular contraction due to blocked electrical conduction pathways. Temporary or permanent pacing is necessary to stabilize the client. Signs of adequate hydration are normal urine-specific gravity, 1.003 to 1.030, adequate volume of urine output, greater than 30 ml per hour, and capillary refill of less than 3 seconds. Pulse pressure narrows in shock, and positive orthostatic vital signs, decreasing systolic blood pressure and rising heart rate, with position change indicate dehydration. The examination for skin cancer follows the ABCDE rule. 1. Asymmetry, e.g., one half unlike the other. 2. Border irregularity, e.g., edges are notched or irregular. 3. Color changes and variation, e.g., different brown or black pigmentation. 4. Diameter of 6 mm or larger, about the size of a pencil eraser. 5. Evolving, e.g., appearance is changing in shape, size, color. Positive end expiratory pressure, PEEP, applies a given pressure at the end of expiration during mechanical ventilation. It counteracts small airway collapse and keeps alveoli open so that they can participate in gas exchange. PEEP is usually kept at 5 cm H2O, 3.7 mm Hg. However, a higher level of PEEP is an effective treatment strategy for acute respiratory distress syndrome, ARDS, a type of progressive respiratory failure that causes damage to the type E surfactant-producing pneumocytes that then leads to atelectasis, noncompliant lungs, poor gas exchange, and refractory hypoxemia. High levels of PEEP, 10 to 20 cm H2O, can cause overdistension and rupture of the alveoli, resulting in barotrauma to the lung. Air from ruptured alveoli can escape into the pulmonary interstitial space or pleural space, resulting in a pneumothorax and/or subcutaneous emphysema.
Drugs commonly associated with orthostatic hypotension include 1. Most antihypertensive medications, particularly sympathetic blockers such as beta blockers e.g., metoprolol, and alpha blockers e.g., terazosin. 2. Antipsychotic medications e.g., olanzapine, risperidone, and antidepressants e.g., selective serotonin reuptake inhibitors. 3. Volume-depleting medications such as diuretics e.g., furosemide, hydrochlorothiazide. 4. Vasodilator medications e.g., nitroglycerin, hydralazine. 5. Narcotics e.g., morphine. CBT involves 5 basic components. Education about the client's specific disorder, self-observation and monitoring. The client learns how to monitor anxiety, identify triggers, and assess the severity. Physical control strategies, deep breathing and muscle relaxation exercises. Cognitive restructuring, learning new ways to reframe thinking patterns, challenging negative thoughts. Behavioral strategies, focusing on situations that cause anxiety and practicing new coping behaviors. Desensitization to anxiety-provoking situations or events. The client with ALS and worsening ability to speak dysarthria may also have dysphagia and respiratory distress. This client should be seen first. Gestational hypertension is new onset high blood pressure, is greater than or equal to 140/90ths of a millimeter Hg, that occurs after 20 weeks gestation without proteinuria.
The development of proteinuria with hypertension indicates preeclampsia, which may manifest with symptoms such as headache, visual disturbances, and facial swelling. Complications of preeclampsia may include thrombocytopenia, liver dysfunction, and renal insufficiency. Use Sims position for enema administration. sitting upright before a paracentesis, and supine after a lumbar puncture. Place a client on right side after a liver biopsy, and keep the client supine after a PCI. Downloaded by DNA Mads, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. Neonate. Expected findings for a neonate at 1 to 3 hours postpartum include respirations between 30 to 60 breaths per minute, millia, and glucose levels less than 70 to 100 mg per deciliter, 3.9 to 5.6 mmol, L, but is greater than or equal to 40 mg per deciliter, 2.2 mmol, L. FTT, or growth failure, is a state of undernutrition and inadequate growth in infants and young children. Most cases of FTT are related to an inadequate intake of calories, which can be tied to many different etiologies. Physiologic risk factors for FTT include preterm birth, breastfeeding difficulties, gastroesophageal reflux, and cleft palate. Socioeconomic risk factors include poverty, most common social or emotional isolation. Parents may lack the support system needed to assist them with the problems of child rearing, cognitive disability or mental health disorder, lack of nutritional education. Parents may not have knowledge of proper feeding techniques or appropriate calorie intake based on age and size of the child. Kawasaki. Once children with KD are discharged home, parents should be instructed to check their temperature every 6 hours for the first 48 hours following the last fever and then daily until the follow-up visit. The healthcare provider should be notified if the child has fever, as this may indicate a need for further treatment. Irritability is a hallmark finding in a child with KD, especially during the acute phase, due to fever and inflammation. Parents should be advised that irritability can last up to 2 months. Temporary joint pain and other manifestations of arthritis, e.g., stiffness, decreased range of motion, may occur and persist for several weeks. Parents should be informed that range of motion exercises and warm baths will help reduce these symptoms and minimize discomfort. Desquamation, skin peeling, of the hands and feet is an expected finding in KD. Parents should be informed that the peeling itself is not painful but that the new skin underneath may be red and sore. The normal range for the number of wet diapers is 6 to 10 per day, or approximately 1 every 4 hours. Infants create 2 milliliters per kilogram per hour normal urine output. The number of wet diapers per day is one of the best indications of adequate fluid intake, hydration. Aphasia refers to impaired communication due to a neurological condition, e.g., stroke, traumatic brain injury. The term aphasia is interchangeable with dysphagia, although aphasia is used more commonly. Receptive aphasia refers to impaired comprehension of speech and writing. A client with receptive aphasia may speak full sentences, but the words do not make sense. The nurse should speak clearly, ask simple, yes or no questions, and use gestures and pictures to increase understanding. Risk for preterm labor. Infection, e.g., periodontal disease, urinary tract infection, places pregnant clients at increased risk for preterm labor and birth.
Other risk factors include history of preterm birth, previous cervical surgery, tobacco, illicit drug use, and maternal age less than 17 or greater than 35. A diagnosis of schizophrenia with catatonia can be made if the clinical features meet the criteria for a diagnosis of schizophrenia and include at least 2 of the following additional features. Immobility. The client remains in a fixed stupor or position for long periods or refuses to move about or engage in activities of daily living or may have brief spurts of excitement or hyperactivity. Remaining mute. Bizarre postures. The client holds the body rigidly in one position. Extreme negativism. The client resists instructions or attempts to be moved. Waxy flexibility. The client's limbs stay in the same position in which they are placed by another person. Staring. Stereotyped movements, prominent mannerisms, or grimacing. Neurogenic shock. A distributive shock. Vascular dilation with decreased venous return to the heart is present due to loss of innervation from the spine.
Classic signs, symptoms are hypotension, bradycardia, and pink and dry skin from the vasodilation. Neurogenic shock usually occurs in cervical or high thoracic injuries, T6 or higher. Downloaded by DNA Mads, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. Intussusception. Causes intermittent cramping and progressive abdominal pain, inconsolable crying, and current jelly stool, from blood or mucus. It is often treated successfully with an air enema. Irregular or excessive menstrual bleeding in premenopausal women or any bleeding in postmenopausal women can be a sign of endometrial cancer. Hirschsprung disease, HD, occurs when a child is born with some sections of the distal large intestine missing nerve cells, rendering the internal anal sphincter unable to relax. As a result, there is no peristalsis and stool is not passed. These newborns exhibit symptoms of distal intestinal obstruction. They have a distended abdomen and will not pass meconium within the expected 24 to 48 hours. They also have difficulty feeding and often vomit green bile. Surgical removal of the defective section of bowel is necessary and colostomy may be required. A potentially fatal complication is Hirschsprung enterocolitis, an inflammation of the colon, which can lead to sepsis and death. Enterocolitis will present with fever, lethargy, explosive, foul-smelling diarrhea, and rapidly worsening abdominal distension. Caring for a burn in the home setting includes gently soaking the area with cool water, removing clothing or jewelry if not stuck to the skin, covering the affected area with clean, dry cloth, bandages, and avoiding application of medication or substances to the wound. A Rayu test involves administering a low dose of radioactive iodine, in contrast to radioactive iodine treatment for some types of thyroid cancer, which uses a high dose to destroy all thyroid tissue. The thyroid gland is the only tissue that uses iodine, which is a key component of thyroid hormones. A scan is performed at 2, 6, and 24 hours to assess the areas actively absorbing iodine, which can narrow the diagnosis to hyperfunctioning thyroid disorders, e.g., Graves' disease. Important nursing considerations. Notify the primary healthcare provider, PHCP, if computerized tomography scan or other recent X-ray using iodine contrast has been performed. The iodine may alter the test results. Antithyroid or thyroid hormone medication should be held for 5 to 7 days before undergoing a Rayu test, as these can also alter results. All premenopausal women must take a pregnancy test before the procedure, as radioactive iodine could adversely affect the development of the fetal thyroid gland. Important aspects of client education. Maintain nothing by mouth, NPO, status for 2 to 4 hours prior to the procedure. Eating may resume 1 to 2 hours after swallowing the iodine. A normal diet can be restarted when the test ends. Remove dentures and jewelry, metal around the neck to allow clear visualization during the scan. Drink plenty of fluids after the procedure to clear Rai from the system. Notify the PHCP if you are allergic to any medications, e.g., iodine. However, a Rayu test is generally safe, even in the presence of an iodine allergy, due to the diminutive amount of iodine used. You will be awake during the procedure, but there should be no discomfort. Do not breastfeed immediately after this procedure, and ask your PHCP when breastfeeding may resume. Primary open-angle glaucoma, POG, is an eye condition characterized by an increase in intraocular pressure and gradual loss of peripheral vision, i.e., tunnel vision. The signs, symptoms of POG develop slowly and include painless impairment of peripheral vision with normal central vision, difficulty with vision in dim lighting, increased sensitivity to glare, and halos observed around bright lights. POG can lead to blindness if left untreated. Retinal detachment is separation of the retina from the underlying epithelium that allows fluid to collect in the space. The signs, symptoms include sudden onset of light flashes, floaters, cloudy vision, or a curtain appearing in the vision. Age-related macular degeneration is a degenerative eye disease that brings about the gradual loss of central vision, leaving peripheral vision intact. A cataract is cloudiness, i.e., opacity, of the lens that may occur at birth or more commonly in older adults. The signs, symptoms of a cataract include painless, gradual loss of visual acuity with blurry vision, scattered light on the lens producing glare and halos, which are worse at night, and decreased color perception. Downloaded by DNA Mads, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. Systemic lupus erythematosus, SLE, is an autoimmune disorder in which an abnormal immune response leads to chronic inflammation of different parts of the body.
SLE ranges in severity from mild, e.g., affecting skin, muscles, joints, to severe, e.g., affecting kidneys, heart, lung, blood vessels, central nervous system disease.
Increased creatinine, normal 0.6 to 1.3 mg per deciliter. Increased blood urea nitrogen, normal 6 to 20 mg per deciliter, and an abnormal urinalysis, e.g., protein, red blood cells, cellular casts, can indicate the presence of lupus nephritis, occurring in 50%, a potentially serious complication of SLE. Early recognition and aggressive immunosuppressive treatment are essential to preserve renal function and prevent irreversible kidney damage. An elevated erythrocyte sedimentation rate, normal less than 30 mm per hour, can indicate the presence of an active inflammatory process and would be expected in a client with an inflammatory disease such as SLE, especially during a disease flare. This is nonspecific and does not give information as to which organ is being attacked by inflammation. A positive anti-nuclear antibody, ANA, titer, greater than 140, indicates the presence of ANAs, which the body produces against its own DNA and nuclear material. This would be expected in a client diagnosed with SLE. Anemia, mild leukopenia, white blood cell count less than 4,000 3, and thrombocytopenia, platelet count less than 150,000 per cubic millimeter, are often present in SLE. The nurse would report these to the healthcare provider, but they are not of greatest concern. Signs of graft leakage that are important to monitor after repair of an abdominal aortic aneurysm include pain in the back, pelvis, or groin, ecchymosis of the groin, scrotum, or penis, tachycardia, weak or absent peripheral pulses, decreasing hematocrit and hemoglobin, increased abdominal girth, and decreased urinary output. Ventilator-associated pneumonia, VAP, classified as a diagnosis of pneumonia more than 48 hours post-endotracheal intubation, is a key area of preventable morbidity and mortality in the hospitalized client. Assessment of suspected pneumonia would denote fever, elevated white blood cell count, purulent or odorous sputum, crackles on auscultation, and pulmonary opacities on X-ray. Trisomy 18, Edwards syndrome, is a chromosome anomaly characterized by severe cardiac defects and multiple musculoskeletal deformities. Life expectancy for trisomy 18 is a few weeks after birth. Neonates rarely survive to their first birthday. End-of-life issues should be discussed early after the diagnosis is confirmed. Trisomy 13, Patau syndrome, also results in early death.
Major predisposing factors for the development of delirium in hospitalized clients include 1. Advanced age. 2. Underlying neurodegenerative disease, stroke, dementia. 3. Polypharmacy. 4. Coexisting medical conditions, e.g., infection. 5. Acid-base arterial blood gas imbalances, e.g., acidosis, hypercarbia, hypoxemia. 6. Metabolic and electrolyte disturbances. 7. Impaired mobility, early ambulation prevents delirium. 8. Surgery, postoperative setting. 9. Untreated pain and inadequate analgesia. Hypertensive encephalopathy. Heat. Neurologic manifestations of hypertensive encephalopathy include visual disturbances, seizures, nausea, vomiting, headache, and altered level of consciousness.
Prompt recognition and pharmacologic treatment to lower the blood pressure are critical to prevent irreversible neurologic deficits. Untreated, he carries high mortality due to the risk of acute myocardial infarction, stroke, and kidney injury. Therefore, this client's condition is a priority. Symptoms of increased intracranial pressure, nausea, vomiting, headache, Guillain-Barré syndrome, is an ascending symmetrical paralysis. It can move upward rapidly or relatively slowly, over days, weeks. Respiratory compromise is the worst complication. Downloaded by DNA Mads, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. To prevent air embolism when discontinuing a central venous catheter, it is important for the nurse to pull the line cautiously, have the client in a supine position, Have the client bear down or exhale, and apply an air-occlusive dressing.
Iron deficiency anemia is the most common chronic nutritional disorder in children.
There are many risk factors for iron deficiency, including insufficient dietary intake, premature birth, delayed introduction of solid food, and consumption of cow's milk before age 1 year. One common cause in toddlers is excessive milk intake, over 24 ounces per day. In addition to becoming overweight, toddlers who consume too much milk develop iron deficiency due to the likely exclusion of iron-rich foods in favor of milk, a poor source of available iron. Treatment of iron deficiency anemia includes oral iron supplementation and increased consumption of iron-rich foods, e.g., leafy green vegetables, red meats, poultry, dried fruit, fortified cereal. It is also important to limit milk intake, 16 to 24 ounces per day, in toddlers to ensure a balanced diet. Cow's milk. Calcium and vitamin D are nutrients in cow's milk that are essential for proper bone development in children and adolescents. To obtain the recommended 500 mg of daily calcium, for ages 1 to 3 years, the parents should serve foods such as beans, dark green vegetables, and calcium-fortified cereals and juices. Vitamin D, which enhances the absorption of calcium, is synthesized in the skin by exposure to direct sunlight. Alternate dietary sources include fish oils, egg yolks, and vitamin D-fortified foods, e.g., orange juice. Neutropenia. The normal range for a WBC count is 4,000 to 11,000, 3, 4.0 to 11.0 times 109, L. Clients with neutropenia, a reduction in WBCS, are predisposed to infection. The absolute neutrophil count, ANC, is determined by multiplying the total WBC count by the percentage of neutrophils. Neutropenia is an ANC below 1000 per cubic millimeter, 1.0 times 109, L. An ANC below 500 per cubic millimeter, 0.5 times 109, L, is defined as severe neutropenia and is a critical emergency. This client's neutropenia is probably a result of bone marrow suppression from the chemotherapy. The client needs reverse or protective isolation from organisms that people or objects may have that the client lacks resistance to. A hospitalized client needs to be in a private room, and the room may need to be equipped with HEPA, high-efficiency particulate air, filtration, or positive pressure airflow. Until the room can be readied, the client should be protected with a mask and separated from infectious clients. Additional neutropenic precautions include avoiding raw fruits, vegetables, standing water, and undercooked meat. In addition, no infectious healthcare providers, e.g., with colds, should care for the client. Chest tube. The suction control chamber, section A, maintains and controls suction to the chest drainage system. Continuous, gentle bubbling indicates that the suction level is appropriate. The amount of suction is controlled by the amount of water in the chamber and not by wall suction. Increasing the amount of wall suction would cause vigorous bubbling but does not increase suction to the client as excess suction is drawn out through the vent of the suction control chamber. Vigorous bubbling would increase water evaporation and therefore decrease the negative pressure applied to the system. The nurse should check the water level and add sterile water, if necessary, to maintain the prescribed level. The water-sealed chamber contains water, which prevents air from flowing into the client. Up and down movement of fluid, titling, in section B would be seen with inspiration and expiration and indicates normal functioning of the system. This will gradually reduce in intensity as the lung re-expands. Mastitis is a common infection in postpartum women due to multiple risk factors leading to inadequate milk duct drainage, e.g., poor latch. Bacteria are transmitted from the infant's nasopharynx or the mother's skin through the nipple and multiply in stagnant milk. Staphylococcus aureus is the most common offending organism. Symptoms of mastitis include fever, breast pain, and focal inflammation, redness, edema. In addition to anti-staphylococcal antibiotics, dicloxacillin or cephalexin, and analgesics, e.g., ibuprofen, treatment of lactational mastitis requires effective and frequent milk drainage. Treatment of lactational mastitis includes antibiotic therapy, breast support, adequate hydration, analgesics, and frequent continued breastfeeding, every 2 to 3 hours. Downloaded by DNA Mads, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. MI in elderly and women. Early recognition and treatment of heart attack are critical. Women, the elderly, and clients with a history of diabetes may not have the classic heart attack symptoms of dull chest pain with radiation down the left arm. Instead, they can present with atypical symptoms such as nausea, vomiting, belching, indigestion, diaphoresis, dizziness, and fatigue. The management of anaphylactic shock includes 1. Ensure patent airway, administer oxygen. 2. Remove insect stinger if present. 3. Im epinephrine is the drug of choice and should be given to this client. Epinephrine stimulates both alpha and beta adrenergic receptors and dilates bronchial smooth muscle, beta 2, and provides vasoconstriction, alpha 1. The IM route, mid-anterior lateral thigh, is better than the subcutaneous route. Repeat dose every 5 to 15 minutes.
4. Place in recumbent position and elevate legs. 5. Maintain blood pressure with IV fluids, volume expanders or vasopressors. 6. Bronchodilator inhaled beta agonist such as albuterol is administered to dilate the small airways and reverse bronchoconstriction. 7. Antihistamine diphenhydramine is administered to modify the hypersensitivity reaction and relieve pruritus. 8. Corticosteroids methylprednisolone are administered to decrease airway inflammation and swelling associated with the allergic reaction. 9. Anticipate cricothyrotomy or tracheostomy with severe laryngeal edema. Exacerbation of COPD is characterized by the acute worsening of a client's baseline symptoms, e.g., dyspnea, cough, sputum color, and production.
NIPF is often prescribed short-term to support gas exchange in clients who have moderate to severe COPD exacerbations and acidosis, pH less than 7.3, or hypercapnia, PaCO2 greater than 45 mm Hg. NIPF can prevent the need for tracheal intubation and is administered until the underlying cause of the ventilatory failure is reversed with pharmacologic therapy, e.g., corticosteroids, bronchodilators, antibiotics. BiPAP involves the use of a mechanical device and face mask in a conscious client who is breathing spontaneously. BiPAP delivers oxygen to the lungs and then removes carbon dioxide, CO2. CO2 retention causes mental status changes. If the client becomes drowsy or confused, it is likely that more CO2 is being retained than what BiPAP can remove. This should be reported to the HCP. Arterial blood gas evaluation should be obtained to determine CO2 level and BiPAP effectiveness. Altered mental status poses the greatest threat to a client's survival as it can lead to decreased protective reflexes, e.g., gag, swallow, cough, periods of apnea, and airway compromise. In a client with COPD exacerbation, it is most important for the nurse to monitor mental status frequently and report changes such as restlessness, decreased level of consciousness, somnolence, difficult arousal, and confusion to the HCP. These signs may indicate increased CO2 retention and worsening hypercapnia, which would necessitate an immediate change in therapy. A knee chest position is used to treat episodes of hypoxia and cyanosis in infants and young children with tetralogy of Fallot, TOF. Pertussis, whooping cough. Pertussis can occur despite vaccination. Characteristic features include a cough lasting is greater than or equal to 2 weeks with is greater than or equal to one of the following: paroxysms of cough, inspiratory whooping sound, and posttussive vomiting. Clients need oral antibiotics, droplet precautions, and supportive measures, humidified oxygen and oral fluids. Is a very contagious communicable disease caused by the Bordetella pertussis bacteria. These organisms attach to the small hairs in the airway and release a toxin that causes swelling and irritation. Pertussis is spread from person to person by coughing, sneezing, and close contact. As a result, an affected client should be placed in standard, universal, and droplet isolation precautions when hospitalized. At first, symptoms similar to the common cold in a mild fever occur, but eventually these clients develop a characteristic violent, spasmodic cough. Coughing is so severe that the person is forced to inhale afterward, resulting in a distinctive, high-pitched, whooping sound. Coughing episodes may continue until a thick mucus plug is expectorated and are sometimes followed by vomiting, posttussive emesis. Treatment consists of antibiotics and supportive measures. Humidified oxygen and adequate fluids will help loosen the thick mucus. Suction as needed is important in infants. Respiratory status should be monitored for obstruction. The client should be positioned on the left side to prevent aspiration if vomiting. Downloaded by DNA Mads, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. Occurs. Vaccination against whooping cough is available, but some individuals will still develop the disease, although in a milder form. Airborne precautions. An airborne precaution such as placing the client in a negative pressure isolation room is needed for individuals with measles, tuberculosis, and varicella zoster, chickenpox, infections, airing MTV. Gait. The client who is rehabilitating from an injury of the lower extremity usually progresses from no touchdown, non-weight-bearing status, using the 3-point gait to touchdown with partial weight-bearing status, using the 2-point gait, to full weight-bearing status, using the 4-point gait. Type I hypoxemic. Failure is associated with an alteration in O2 transfer, e.g., acute respiratory distress syndrome, pulmonary edema, shock. Type E hypercapnic, or ventilatory. Failure is associated with CO2 retention, e.g., chronic obstructive pulmonary disease, myasthenia gravis, flail chest. ABG values that indicate the presence of ARF or POW2 is less than or equal to 60 mm Hg, 8.0 kPa, POCO2 is greater than or equal to 50 mm Hg, 6.67 kPa, and pH is less than or equal to 7.30. Vaccines to give during pregnancy. The tetanus, diphtheria, and pertussis (Tdap) vaccine is recommended for all pregnant women between the beginning of the 27th and the end of the 36th week of gestation, as it provides the newborn with passive immunity against pertussis, whooping cough, impaired wound healing. Nutritional deficiencies, e.g., zinc, protein, vitamin C, and dehydration, hypernatremia, elevated BUN, can impair wound healing. TPN. The recommended target serum glucose range for clients receiving nutritional support is 140 to 180 mg per deciliter, 7.8 to 10.0 mmol, L. The nurse should monitor a client receiving TPN for hyperglycemia, serum glucose greater than 180 mg per deciliter, and hypoglycemia, serum glucose less than 70 mg per deciliter. Hypoglycemia places the client at risk for life-threatening complications, e.g., seizures, nervous system damage. Infants born to HIV-positive clients should receive at least 4 to 6 weeks of ART after birth to reduce the chance of developing HIV infection. Infants are tested for HIV infection at birth and again at age 1 and 4 months. Identification of HIV negative status requires 2 consecutive negative results at age is greater than or equal to 1 month and is greater than or equal to 4 months. DKA. The severe hyperglycemia of diabetic ketoacidosis, DM1, and hyperosmolar hyperglycemic state, DM2, causes severe dehydration from an osmotic diuresis. IV normal saline resuscitation should be started before any other therapy. Myxedema coma is a complication associated with progression of symptoms of hypothyroidism from lethargy and mental sluggishness to a coma state. This client has hypothermia, bradycardia, hypotension, and depressed mental status. Hypothyroidism can also cause hypoventilation due to central depression of respiratory drive, respiratory muscle fatigue, and mechanical obstruction by a large tongue. This client exhibits signs of acute respiratory distress, increased respirations, very low oxygen saturation. Therefore, life-saving measures to facilitate respiratory support, such as mechanical ventilation, must be implemented first. Downloaded by DNA Mads, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. Metabolic syndrome, insulin resistance syndrome, have an increased risk of diabetes and coronary artery disease. The presence of abdominal obesity causes increased insulin production, hyperinsulinemia. This excess insulin leads to insulin resistance, the primary feature of metabolic syndrome.
Metabolic syndrome is characterized by the presence of 3 or more of the following criteria. Increased waist circumference is greater than or equal to 40 and 102 centimeters in men, is greater than or equal to 35 and 89 centimeters in women. Option 2, blood pressure is greater than or equal to 130 millimeters Hg systolic or is greater than or equal to 85 millimeters Hg diastolic or drug treatment for hypertension. Option 3, triglyceride level greater than 150 milligrams per deciliter, 1.7 mmol/L, or drug treatment for elevated triglycerides. Option 5, high-density lipoprotein (HDL) levels less than 40 milligrams per deciliter, 1.04 mmol/L, in men and less than 50 milligrams per deciliter, 1.3 mmol/L, in women, or drug treatment for low HDL-C. Fasting glucose levels is greater than or equal to 100 milligrams per deciliter, 5.6 mmol/L, or drug treatment for elevated blood glucose. Option 4, the mnemonic for metabolic syndrome is, we better think high glucose, waist circumference, blood pressure, triglyceride, HDL, glucose.
Infants, food. The pincer grasp, a thumb to forefinger movement, develops at age 8 to 10 months. This is the time to start offering small finger foods, such as Cheerios or cut-up pieces of nutritious foods. Caregivers should inform their healthcare provider if the infant does not achieve this significant milestone in fine motor development. Egg whites should not be offered to infants aged less than 1 year. Protein in egg whites can cause an allergic reaction. Infants should be transitioned to whole milk, not low-fat milk, at age 1 year. Due to its rapid growth, the child's brain requires the fat found in whole milk. Concussion is considered a minor traumatic brain injury and results from blunt force or an acceleration, deceleration head injury. Typical signs of concussion include 1. A brief disruption in level of consciousness. 2. Amnesia regarding the event, retrograde amnesia. 3. Headache. These clients should be observed closely by family members and not participate in strenuous or athletic activities for 1 to 2 days. Rest and a light diet are encouraged during this time. The following manifestations indicate more serious brain injury and are not expected with simple concussion. Worsening headaches and vomiting indicate high intracranial pressure. Sleepiness and/or confusion indicate high intracranial pressure. Visual changes. Weakness or numbness of part of the body. Spina bifida is a defect in which the spinal cord contents can protrude through the vertebrae that did not close. The mildest form is spina bifida occulta, most often at the 5th lumbar or 1st sacral vertebrae. A tuft of hair or a hemangioma may be seen over the site. This is distinguished from lanugo, which is fine downy hair on the back that gradually falls out. A term infant will have minimal lanugo. There has been less incidence of spina bifida as there is awareness of the role of folic acid during pregnancy. The defect needs surgical repair. Depending on the location of the defect, the child can have bowel and bladder incontinence, hydrocephalus, and sensory loss. Caput succedaneum, downloaded by DNA Mads, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. Is a localized soft tissue edema of the scalp from the prolonged pressure of the head against the mother's cervix during labor. It feels spongy and crosses the suture line. Caput succedaneum equals crosses suture. Cephalhematoma does not cross the suture lines. Caput succedaneum resolves within the first week of life. Ventricular tachycardia, VT, can be pulseless or have a pulse. Treatment is based on this important initial assessment. VT with a pulse should be further assessed for clinical stability or instability. Signs of instability include hypotension, altered mental status, signs of shock, chest pain, and acute heart failure. The unstable client in VT with a pulse is treated with synchronized cardioversion. The stable client in VT with a pulse is treated with antiarrhythmic medications, e.g., amiodarone, procainamide, sotalol. Hyperparathyroidism is usually due to a benign adenoma on the parathyroid gland. The parathyroid gland produces parathyroid hormone, PTH, which regulates serum calcium levels. The majority of the body's calcium is stored in the bones, and elevated levels in PTH will accelerate osteoporosis as calcium is released from storage. Elevated serum calcium is excreted into the urine, forming kidney stones, nephrolithiasis. In addition, calcium has a diuretic effect, producing symptoms of polyuria and polydipsia. High calcium levels can cause constipation. Hypokalemia may manifest as muscle cramps, weakness, or paralysis and typically starts with the leg muscles. Hypokalemia could be dangerous in this client due to possible arrhythmias in the presence of existing cardiac dysfunction. Iodinated contrast, used for CORT scan or cardiac catheterization, can cause kidney injury. Metformin, glucophage, can worsen lactic acidosis in the presence of kidney injury. Metformin should be withheld prior to the contrast exposure and can be resumed when kidney function is within normal limits. Opioid withdrawal. When a person has used a substance heavily for a long time and it is stopped or reduced, a set of physiological symptoms occurs as the amount of the substance in the system decreases. Heroin is a commonly abused opioid drug. Generalized myalgias, abdominal cramps, diarrhea, piloerection, goosebumps, and pupillary dilation are consistent with opioid withdrawal. Other common features include nausea, vomiting, frequent yawning, restlessness, rhinorrhea, and increased lacrimation. Necrotizing enterocolitis occurs predominantly in preterm infants secondary to gastrointestinal and immunologic immaturity. On initiation of enteral feeding, bacteria can be introduced into the bowel, where they can proliferate excessively due to compromised immune clearance. This results in inflammation and ischemic necrosis of the intestine. As the disease progresses, the bowel becomes congested and gangrenous with gas collections forming inside the bowel wall. Measuring the client's abdominal girth daily is an important nursing intervention to note any worsening intestinal gas-associated swelling. Clients are made NPO and receive nasogastric suction to decompress the stomach and intestines. Parenteral hydration and nutrition and IV antibiotics are given. Compartment syndrome is a limb-threatening emergency that can occur after fracture reduction. Neurovascular checks should always be performed first. The client should not have numbness or tingling. If pain is not relieved, especially with passive range of motion, by prescribed pain medication or is out of proportion to the injury, the nurse should notify the healthcare provider. The Bishop score, downloaded by DNA Mads, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. Is a system for rating the inducibility of the cervix. The cervix is scored 0, 1, 2, or 3, on consistency, position, dilation, effacement, and station of the fetal presenting part. Usually, a score is greater than or equal to 8 indicates that labor induction will be successful, i.e., result in vaginal birth. Oxytocin-induced uterine tachysystole and non-reassuring fetal heart rate tracing are managed with immediate discontinuation of oxytocin, turning to or maintaining the side-lying position, and giving 10 L oxygen by face mask and IV fluid bolus. If there is no response, terbutaline may be needed. Infectious mononucleosis. A serious complication of infectious mononucleosis is a ruptured spleen, which would cause sudden onset of severe abdominal pain in the left upper quadrant. A positive air pressure room pushes air out of the room by increasing the rate of flow. It is used for immunosuppressed clients to prevent the organisms of a normal environment from entering the room. A negative air pressure room is a ventilation system that removes more exhaust air from the room than air allowed into the room. It prevents the infection from spreading out into the environment. A negative air pressure flow room would be required to prevent the airborne spread of the disease. Troponin is a highly specific cardiac marker for the detection of MI. It has greater sensitivity and specificity for myocardial injury than creatine kinase, CK-MB. Serum levels of troponin increase 4 to 6 hours after the onset of MI, peak at 10 to 24 hours, and return to baseline after 10 to 14 days. A troponin value of 0.7 nanograms per milliliter, 0.7 mcg/L, indicates cardiac muscle damage and should be the priority and immediate focus of the nurse. Normal values. Troponin I less than 0.5 nanograms per milliliter, less than 0.5 mcg/L, troponin T less than 0.1 nanograms per milliliter, less than 0.1 mcg/L. Infants begin to roll at age 4 to 5 months. Left to right cardiac shunts, e.g., patent ductus arteriosus, atrial septal defect, ventricular septal defect, result in excess blood flow to the lungs. Manifestations include heart murmur, poor weight gain, diaphoresis with exertion, and signs of heart failure. Colostomy irrigation allows the client to create a bowel regimen and to apply a dressing or smaller pouch device over the stoma. To properly irrigate the stoma, use 500 to 1000 milliliters of lukewarm water, hang the bag 18 to 24 inches above the stoma, use the cone-tipped irrigator to slowly infuse the solution, and allow stool to drain through the sleeve into the toilet. Orthostatic hypotension. In healthy, well-hydrated people, blood pressure and pulse do not significantly alter with a change in position. In the normal mechanism, vasoconstriction prevents large amounts of blood from pooling in the extremities when standing up. When a person is significantly dehydrated, vasoconstriction has already occurred. A loss of about 25% of blood volume is necessary for hypotension to occur. Therefore, there is no compensation capacity available in a dehydrated client with position change, and dropping blood pressure and rising pulse result. Orthostatic vital signs should first be done supine, then sitting, then standing, with 2 minutes between each position change. Positive orthostatic vital signs are present when systolic blood pressure drops by at least 20 mm Hg or diastolic blood pressure drops by at least 10 mm Hg. The pulse usually rises at least 20 beats per minute. Associated symptoms, related to decreased cerebral perfusion, include dizziness, weakness, blurred vision, and syncope. These clients are expected to receive fluid replacement with isotonic solutions, e.g., normal saline, lactated ringers. Spinal immobilization is not a benign procedure. An acronym to help determine the need for spinal immobilization is NSAIDS, downloaded by DNA Mads, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. N. Neurological examination. Focal deficits include numbness and decreased strength. S. Significant traumatic mechanism of injury, alertness. The client may be disoriented or have an altered level of consciousness, option 2. I. Intoxication. The client could have impaired decision-making ability or lack awareness of pain, option 1. D. Distracting injury. Another significant injury could distract the client from spinal pain. S. Spinal examination. Point tenderness over the spine or neck pain on movement, if there is no midline tenderness, may be present, option 5. Anaphylactic shock has an acute onset, and manifestations usually develop quickly, 20–30 minutes. It is caused by a systemic IgE-mediated hypersensitivity allergic reaction to drugs, foods, and venom. Anaphylactic shock results in hypotension and respiratory manifestations, including laryngeal edema, from inflammation, and bronchoconstriction, primarily from release of histamine. These can lead to cardiac and respiratory arrest. The management of anaphylactic shock includes 1. Call for help. Activate emergency management systems, first action 2. Maintain airway and breathing. Administer high-flow O2 via non-rebreather mask 3. Epinephrine, intramuscular, the drug of choice and should be given next. Epinephrine stimulates both alpha and beta adrenergic receptors, dilates bronchial smooth muscle, beta 2, and provides vasoconstriction, alpha 1. The IM route is better than the subcutaneous route. The dose should be repeated every 5 to 15 minutes if there is no response. 4. Elevate the legs 5. Volume resuscitation with IV fluids 6. Bronchodilator such as albuterol is administered to dilate the small airways and reverse bronchoconstriction. 7. Antihistamine, diphenhydramine, is administered to modify the hypersensitivity reaction and relieve pruritus. 8. Corticosteroids, methylprednisolone, are administered to decrease airway inflammation and swelling associated with the allergic reaction. DKA. The client is exhibiting the cardinal signs and symptoms of diabetic ketoacidosis. DKA. DKA is an acute life-threatening complication, typically of type I diabetes, characterized by hyperglycemia, ketosis, and acidosis. It is caused by an intense deficit of insulin. Glucose cannot be used properly for energy when this deficit occurs and the body begins to break down fat stores, producing ketones, a byproduct of fat metabolism, resulting in metabolic acidosis. The lack of insulin also results in increased production of glucose in the liver, further exacerbating hyperglycemia. Because some of the symptoms of hypoglycemia and DKA overlap, a blood glucose level should be checked to ensure that hyperglycemia is present. Hyperglycemia can cause osmotic diuresis, leading to dehydration. In addition, ketones are excreted in the urine as the body tries to restore its pH balance. Vital electrolytes such as sodium, potassium, chloride, phosphate, and magnesium become depleted during the process. Cardinal signs of dehydration such as poor skin turgor, dry mucous membranes, tachycardia, orthostatic hypotension, weakness, and lethargy can occur. The nurse should start an IV and bolus the client with normal saline or 1/2 normal saline to reverse dehydration. This should occur prior to treating the hyperglycemia with regular insulin IV infusion. Because insulin promotes water, potassium, and glucose entrance into the cell, it can exacerbate vascular dehydration and imbalance of electrolytes, particularly potassium. A potassium level, along with other electrolytes, should also be assessed prior to beginning the prescribed insulin therapy. Other signs associated with DKA include small respirations, deep, rapid respirations that have a fruity, acetone smell as the carbon dioxide is exhaled. This compensatory mechanism results in a downloaded by DNA MADS, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. Lowered PaCO2 in an attempt to restore the body's normal pH level and should not be reversed. Option 2. The primary intervention for trigeminal neuralgia includes pain control and limiting pain triggers. The drug of choice is carbamazepine. Triggers can include washing the face, chewing food, brushing teeth, yawning, or talking. Carbamazepine is associated with agranulocytosis, leukopenia, and infection risk. Clients should be advised to report any fever or sore throat. Cushing's syndrome include skin manifestations such as easy bruising, purple striae, and skin atrophy, topical preparations, which are a result of collagen loss. Fat redistribution resulting in truncal obesity and moon-like face, thin extremities. Fat pads are seen on the neck and supraclavicular areas. Option 5. In women, androgens are produced in the adrenal gland. Androgen excess from adrenal gland stimulation can result in acne, hirsutism, and menstrual irregularities. Oligomenorrhea. Option 1. Mineralocorticoid, aldosterone, excess can result in hypernatremia, hypokalemia, and hypertension. Option 4. Hyperglycemia as a result of excess corticosteroids. Untreated clients can develop proximal muscle weakness and bone loss, steroids catabolic on muscles and bone. Morning sickness, characterized by nausea with or without vomiting, is a common problem during the first trimester of pregnancy. Although it is referred to as morning sickness, it can happen anytime throughout the day. It is thought to be due to rising hormone levels, i.e., estrogen, progesterone, human chorionic gonadotropin. Initial interventions, focusing on diet management and triggering avoidance, include eating several small meals during the day, i.e., high in protein or carbohydrates and low in fat, drinking fluids, preferably clear, cold, carbonated beverages, between, rather than with, meals, having a high protein snack before bedtime and on awakening. Option 3, consuming foods, drinks with ginger, e.g., ginger tea, ginger lollipops, ginger chews, consuming foods high in vitamin B6, e.g., nuts, seeds, legumes. Positive pressure ventilation causes increased intrathoracic pressure and reduced venous return and cardiac output, which can result in hypotension. The schedule of recommended routine immunizations for a 6-month-old client includes Hep B, DTaP, RV, HIB, IPV, and PCV. A mnemonic is B. Dr. Hep B, DTaP, RV, HIB, IPV, PCV. The newborn with a myelomeningocele is at risk for infection. Covering the myelomeningocele with a sterile, moist dressing is indicated to decrease the risk of infection at the site. The infant should be placed on the abdomen, prone, with the face turned to the side. Elevation of BNP to greater than 100 pg per milliliter is seen in heart failure. It aids in the assessment of the severity of heart failure and helps distinguish cardiac from respiratory causes of dyspnea. Hepatic encephalopathy is a serious complication of end-stage liver disease caused by high levels of ammonia in the blood. Assessment findings include confusion, lethargy, and asterixis. Coma and death can occur if this condition remains untreated. Pharmacologic treatments include lactulose and antibiotics, e.g., rifaximin. The client with worsening encephalopathy is not stable enough for discharge. Downloaded by DNA Mads, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. The conventional pulse oximeter is not effective in identifying hypoxia in co-poisoning. Diagnosis requires co-oximetry of a blood gas sample. The priority action is to administer 100% oxygen using a non-rebreather mask to treat hypoxia and help eliminate CO. Severely immunocompromised children, e.g., corticosteroid therapy, chemotherapy, AIDS, generally should not receive live vaccines, e.g., measles, mumps, rubella, rotavirus, intranasal influenza, yellow fever, varicella-zoster vaccine. Passive immunization may be the only option for children with severe immunosuppression or those unable to mount an antibody immune response. Phenylketonuria requires lifetime dietary restrictions. Infants should be given special formulas, e.g., low phenolic. For children and adults, high phenylalanine foods, e.g., meats, eggs, milk, should be restricted and replaced with protein substitutes. For medical procedures, the nurse should ensure that the client has an empty bladder and is in high Fowler's or a sitting position for paracentesis, as Trendelenburg on the left side for suspected air embolism has the arm raised above the head on the affected side for chest tube insertion lies on the right side, for 2 hours, and then supine, 12 to 14 hours, after liver biopsy is side lying with the head, back, and knees flexed for lumbar puncture. Cushing's triad is related to increased intracranial pressure, ICP. Early signs include change in level of consciousness. Later signs include bradycardia, increased systolic blood pressure with a widening pulse pressure, difference between systolic and diastolic, and slow to regular, Shane-Stokes, respirations. Cushing's triad is a later sign that does not appear until the ICP is increased for some time. It indicates brainstem compression. Autonomic dysreflexia is a life-threatening condition in a client with high spinal cord injury. Classic signs, symptoms include severe hypertension, throbbing headache, diaphoresis, bradycardia, flushing, and piloerection. Emergency treatment includes correcting the cause, check bowel or bladder distension, removing tight clothing, and raising the head of the bed. Clients with a high, T6 or above, spinal cord injury are at risk for autonomic dysreflexia, autonomic hyperreflexia. It is an uncompensated sympathetic nervous system stimulation. Classic signs include hypertension, up to 300 mm Hg systolic, throbbing headache, diaphoresis above the level of injury, bradycardia, 30 to 40 per minute, piloerection, goosebumps, flushing, and nausea. This is a life-threatening condition that requires immediate intervention to prevent complications, e.g., hypertensive stroke, seizures. Clients with a spinal cord injury should have their blood pressure checked when they report a headache, option 3. The most common cause of autonomic dysreflexia is bladder irritation due to distension. The client needs to be catheterized or the possibility of a kink in the existing catheter must be assessed. Option 2. Bowel impaction can also be a cause. A digital rectal examination should be performed. Constrictive clothing should be removed to decrease skin stimulation. Option 5. The primary healthcare provider should be notified. An alpha-adrenergic blocker or an arteriolar vasodilator, e.g., nifedipine, may be prescribed. Infants are susceptible to hyponatremia secondary to water intoxication, which can present with neurological symptoms, e.g., lethargy, irritability, seizures. Breast milk and/or formula provide sufficient hydration for the first 6 months of life. Formula should not be diluted to save money. Psoriasis is a chronic autoimmune condition characterized by exacerbations of silver plaques on reddened skin. Although there is no cure, management includes topical and systemic medications, phototherapy, and avoidance of triggers. Pericardial effusion is a buildup of fluid in the pericardium. Tamponade, a serious complication of pericardial effusion, develops as the effusion increases in volume and results in compression of the heart. The heart struggles to contract effectively against the fluid, and cardiac output can downloaded by DNA MADS, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. Decrease drastically. This life-threatening complication requires an emergency pericardiocentesis, a needle inserted into the pericardial sac to remove fluid.
Signs and symptoms of cardiac tamponade include hypotension with narrowed pulse pressure, option 1, muffled or distant heart tones, option 4, jugular venous distension, option 5, pulsus paradoxus dyspnea, tachypnea, tachycardia. General interventions to maintain gastric suction when using a Salem sump tube include maintaining client in semi-Fowler's position, accurate assessment of bowel sounds, keeping the air vent, blue pigtail open and above the level of the client's stomach, providing mouth care every 4 hours to maintain moisture of oral mucosa and promote comfort, inspecting the drainage system for patency. The preferred site for intramuscular injection in neonates is the vastus lateralis muscle in the anterolateral middle portion of the thigh.
A tuberculin syringe should be used, and medication dosages should be calculated to 2 decimal places. A 5/8-inch, 22 to 25 gauge needle should be selected for intramuscular injection in the neonate. Metabolic syndrome, insulin resistance syndrome, is characterized by a group of health complications that increase a client's risk for the development of diabetes mellitus and cardiovascular disease. Criteria for metabolic syndrome include the presence of 3 or more of the following 5 conditions. 1. Abdominal obesity with increased waist circumference, is greater than or equal to 40 inches in men, is greater than or equal to 35 inches in women. 2. High serum triglycerides greater than 150 mg per deciliter, 1.7 mmol, L, or on drug treatment for elevated triglycerides. 3. Low HDL cholesterol, less than 40 mg per deciliter in men, less than 50 mg per deciliter in women. 4. Hypertension is greater than or equal to 130/85 of a millimeter Hg or on drug treatment for elevated blood pressure. 5. Fasting blood glucose level is greater than or equal to 100 mg per deciliter, 5.6 mmol, L, or on drug treatment for hyperglycemia. Phosphate level is high, normal adult, 2.4 to 4.4 mg per deciliter.
Magnesium level is low, normal adult, 1.5–2.5 mec. L. Neurogenic shock, hypotension and bradycardia. Signs of abuse may include shaken baby syndrome, i.e., irritability or lethargy, poor feeding, emesis, seizures, burns in the shape of household items, e.g., iron, spatula, from cigarettes, or from immersion in scalding liquid, repeated injuries in varied stages of healing, e.g., bruises, burns, fractures. Option 4, injuries to genitalia. Lapsed time between the injury and the time when care is sought, inconsistency between the injury and the caregiver's explanation of the injury, e.g., client's developmental age, mechanism of injury. Downloaded by DNA MADS, alt.001900@gmail.com, Lomoarch CPSD, 19,001,587.
Bone healing after fracture depends on multiple factors, including age, nutritional status, and perfusion. A client with peripheral arterial disease is at risk for impaired bone healing. Percutaneous coronary intervention via the femoral approach places the client at increased risk for retroperitoneal hemorrhage, which is exacerbated by anticoagulants. Back pain, hypotension, flank ecchymosis, Gray-Turner sign, hematoma formation, and diminished distal pulses can be early signs of bleeding into the retroperitoneal space and require immediate intervention. A client with signs of basilar skull fracture, e.g., periorbital hematomas, bruising behind the ear, leakage of cerebrospinal fluid, requires immediate cervical spine immobilization, neurologic assessment, and airway, breathing, and circulation support. During mass casualty events, the goal is to do the greatest good for the greatest number of people.
Clients are triaged using various systems, e.g., simple triage and rapid transport treatment, sort, assess, life-saving interventions, treatment transport, and placed into 4 categories. Immediate red tag, life-threatening injuries with good prognoses once treated, e.g., airway obstruction, open fractures, 2nd or 3rd degree burns covering 15%-40% body surface area, delayed yellow tag, injuries requiring treatment within hours, e.g., stable abdominal wounds, soft tissue injuries, minimal green tag, injuries requiring treatment within a few days, e.g., minor burns or fractures, small lacerations, expectant, black tag, extensive injuries, poor prognosis regardless of treatment. Peristomal skin irritation is prevented by ensuring that ostomy appliances fit closely around the stoma and that the appliance is changed every 5 to 10 days.
The ostomy bag is emptied when 1/3 full. The client with a colostomy is encouraged to drink plenty of fluids and decrease intake of gas-forming foods.
A uroseptic client with chronic kidney disease and hyperkalemia should be treated with IV isotonic fluid boluses and IV broad-spectrum antibiotics.
Blood and urine cultures should be obtained. The nurse would question the administration of iodinated contrast to a client with significant kidney disease. ACE inhibitors and angiotensin E receptor blockers should be avoided in clients with hyperkalemia. Preeclampsia is a multisystem disorder that occurs after the 20th week of pregnancy. Preeclampsia is defined as new onset hypertension, is greater than or equal to 140/90ths of a millimeter Hg, after 20 weeks gestation plus proteinuria or signs of end organ damage. Proteinuria diagnostic of preeclampsia is defined as is greater than or equal to 300 mg 24 hours, 0.3 grams per day. Urine collection, protein-creatinine ratio is greater than or equal to 0.3, or dipstick of is greater than or equal to 1+, option 2. Cerebral symptoms, such as headache and visual changes, are potential manifestations of preeclampsia and reasons for concern, option 4. With severely elevated blood pressure, there is risk of cerebral edema, hemorrhage, and stroke. It is important to prevent the progression of preeclampsia to eclampsia, new onset seizure in the presence of preeclampsia, to tonic-clonic seizures. Edema occurs in many normal pregnant women as well as those with preeclampsia. Although edema is not part of the diagnostic criteria for preeclampsia, it is a common manifestation of the disease process, option 1. Torch infections, toxoplasmosis, other, rubella, cytomegalovirus, herpes simplex virus, can cause fetal abnormalities, and clients with these infections should not be assigned to pregnant healthcare workers. Downloaded by DNA Mads, alt.001900@gmail.com, Lomoarch PSD, 19,001,587. A contraction stress test, CST, evaluates fetal well-being under stress by identifying uteroplacental insufficiency. Uterine blood flow is decreased during uterine contractions, which stresses the fetus during labor. Contractions are stimulated using either oxytocin administration or nipple stimulation. A fetal tracing is evaluated until 3 uterine contractions, each lasting 40 to 60 seconds, are captured within 10 minutes. A negative test has no late or variable decelerations and is associated with good fetal outcomes. A negative CST with a reactive non-stress test provides strong reassurance of fetal well-being. Chronic obstructive pulmonary disease, COPD, is most commonly caused by inhaling irritants, e.g., cigarette smoke, air pollution, and may include emphysema and/or chronic bronchitis. Emphysema is characterized by alveolar wall destruction. Lung tissues lose elasticity, recoil, due to permanently enlarged, floppy, alveoli. This causes hyperinflation of the lungs, air trapping, manifested by hyperresonance on percussion and prolonged expiration, option 3. Hyperinflation of the lungs causes the client to develop a barrel-shaped chest, option 2. Hyperinflated lungs also prevent the client from meeting oxygen demands during increased activity, leading to activity intolerance and anxiety, option 1. Pursed lip breathing, puffing, accessory muscle use, and the tripod position, leaning forward with hands on the knees, are seen during exertion and as the disease progresses. For clients with increased intracranial pressure, the nurse should reduce metabolic demands, e.g., treat fever and/or pain, promote venous blood return, e.g., keep the head midline at 30 degrees, maintain a quiet environment, administer stool softeners to prevent straining, and suction only when needed. 58. Increase ICP, hypertension, bradypnea, bradycardia, Cushing's triad, 59. Shock. Hypotension, tachypnea, tachycardia. Downloaded by DNA Mads, alt.001900@gmail.com, Lomoarch PSD, 19,001,587.